Robin Grant, Newport Beach City Council.
John Campbell, Mayor Pro Tem, San Juan Capistrano.
Thank you, John.
Lori Durand, Advocates for Responsible Treatment.
Thank you, Lori. Okay, we have some folks sitting out there, so welcome. I see my city manager. Hi, Lane. So we appreciate everybody joining us. With that said, I'd like to ask Chris. Please, come on up, please. Actually, come on right up here, come on, because we have a couple people that aren't here, and there's some, so please join us. Welcome. Please introduce yourself if you don't mind. I'm putting you on the spot.
Melinda Liu, Irvine City Council, District 1.
Thanks for joining us. We appreciate it. Okay. Chris, will you go ahead and give us a status update on the transition?
Happy to. One, very positive.
I know.
And a huge thank you to Elaine and to Joel Curley and Wendy Bucknam's leadership and the full council. Mission Gallejo filed all the paperwork so that CASLR is now a 501c3 nonprofit. And that enables a lot of things, including being able to open up a bank account, being able to secure funding for the operation and expansion of our work, and ACCOC's board has agreed to help with the administrative oversight of those things. So we're working to get all of those mechanics in place now that the filing is complete. So thank you very, very much.
Thank you, ACCOC.
Appreciate it. Also just want to share that we just had a very successful webinar last week with just about, if not more than 80 individuals who participated. It was done online. I want to thank Diane Dixon, who presented, Assemblywoman Dixon, who presented the JLAC audit and really walked everyone through the mechanics of that, the outcomes and the results of that. And then also Kim Shaw, City Attorney for Costa Mesa, who gave a legal update on some of the federal rulings and the outcomes of their legislative efforts, or sorry, legal efforts, and some of the enhanced local controls that may be available as a result of some of those federal rulings. So a lot of that information is all being assembled that came out of that, and I believe, Jeff, you guys are going to put that on the CASLR website, so that if you weren't able to, and we also have a recording of the whole Zoom that will also be available. So if you weren't able to attend, you'll be able to review that at your convenience.
Great information at that, and it was 1 hour.
Yeah.
So, it's definitely worthwhile.
Yeah.
Okay, next up, Nick, you have some information for us, and you're going to share a county update.
Yep.
And then are you also going to give the legal update, or is Nicole?
Nicole couldn't make it, so.
It's okay.
So
we're going to wrap up the update.
we'll wrap that up, then we can
Yeah.
have Nicole.
Okay.
You know, maybe could we just talk briefly though, and we can put Connor Medina, who also presented on the webinar. My apologies, Connor, I should have brought that up. Cal Cities gave a good update on some of the state legislative reforms that are being introduced, but maybe you and Kristen on behalf of Assemblywoman Dixon's office and Valerie Mesco, Mayor of Santa Ana, who are going to be involved in some of these reforms, with Assemblywoman Davies reaching out on a potential pilot program. But maybe just an update on some of the legislative work, because we really do need to rally the troops to get support letters up to SAC as soon as possible for all of these. So I hate to put you all on the spot, but
Okay, who do you want to start?
maybe Connor, and then you guys can all tag team.
Okay.
Sure, yeah. So my colleague Caroline Grinder, our lobbyist on these issues, who's more on the ground on the formulation of the bills that we're sponsoring with the offices. She's online, so I can turn it over to Caroline, but I also don't know if the office is like from Kristen with Assemblywoman Dixon. There might be other offices on the line who don't want to steal their thunder. So Caroline, I'm sure you can see everybody who's on the Zoom and you can defer as needed, but I'll pass it over to you.
Okay, great, and thank you all for having me today. I'm sorry if there's any background noise. I'm in an airport, but this is our top priority, so I wanted to make sure we were available. We are really excited to be back with a package of bills this year on this topic, hoping to build off the success that Cal Cities had last year. We were able to get 2 of our bills on this issue signed by the governor last year, working with Assemblymember Valencia and Assemblymember Davies. And we were really excited about that. You know, we've been working on this issue for over a decade and have yet to get a bill signed by the governor, so it was a really big deal for us last year to get those 2 across the finish line. So we've got 3 bills. I'm happy to, I know we've got a couple of the offices on the line too, so I don't want to steal all the thunder, but I'm happy to give a quick overview of where Cal Cities is coming from and then let them fill in any of the gaps I'm missing. But the first bill that we're working on is AB 424 Davies. That bill is going to require the Department of Healthcare Services to notify complainants when their complaint has been received, when the investigation of their complaint has concluded, and the outcome of that investigation. This idea came through our cities. We know that it's been really challenging for city officials to get updates on the status of complaints that have been filed. Currently, the department requires that you file a public records request in order to access the outcome of your complaint, which leaves a lot of people just calling the department and not really getting answers about what's been happening. And so we're hopeful through this bill we can create more communication between the department and the people who file complaints, so that we can make sure that we have more transparency when it comes to the outcomes of those investigations. The next bill that we're working on is AB 429 Valencia. This would require the Department of Healthcare Services to notify a city anytime a new license is approved in their jurisdiction. This is an idea we ran last year and are bringing back this year, came through our cities. I think on its face, it may not seem like a huge change, just notifying cities anytime a license is approved. You can access this information on the website, but
I lost you, Caroline. Here, I can take it from here.
Seamless.
Seamless. So this is helpful, AB 492, because when this info is relayed in real time to city officials, you know the rate at which these new licenses are being received, and can be better prepared to more proactively and effectively integrate these facilities into your community, and have knowledge from the outset rather than being reactive to whenever this license is approved and however long it had been since you last checked and that license had been approved. It just makes it a much less difficult process for local officials. And then lastly,
Connor, was that AB 429 or?
AB 492.
492, thank you.
With Assemblyman Valencia. And then lastly, SB 329 with Senator Catherine Blakespear. And we would implement the timelines for the Department of Healthcare Services to, did Caroline do SB 329?
No.
Yeah, okay, just want to
No.
make sure. The numbers always get me all jumbled up. SB 329, existing law requires DHCS to investigate complaints, but as we saw from the audit that Samuel and Dixon successfully got approved, and now we see the results, that process can take upwards of a year to get those resolved. So it's directly taking a recommendation from the audit and requiring a 10-day window for staff to be assigned from DHCS to review the complaint, and then a 60-day window to complete that investigation. So much more timely resolution for operators who may not be, following the law. At this time, we're waiting and waiting and waiting to get those answers, and now with SB 329, the intent is a 60-day window, a much more reasonable time frame for us to work with. So those are the bills that we are sponsoring this year on recovery housing, but I'm happy to pass it over to any other legislative offices.
Why don't we go ahead and start with, Chris, do you want to go ahead?
Sure, yes, happy to. Again,
Assemblywoman
Kristen,
Dixon.
on behalf of Assemblymember Diane Dixon. Thank you for that update. She too has quite a package on this space, of course, very important to her, will continue to be a priority. And, the good news, bad news, I guess, of the audit, as we mentioned, is it showed that there's a lot that we need to be doing better in the state. So one of the first piece of legislation, which I think she mentioned, and those who joined the call last week, was AB 3, which she introduced on the first day of the session in December. That was taken directly from the audit, which talked about the fact that there are operators who are sharing facilities and sharing services and sharing amenities, and ultimately creating sort of mini institutions in our neighborhoods, which is directly contradicting what the original intent of legislation way back in the 70s was, which was to de-institutionalize treatment, so that folks hopefully are getting better and also learning how to reintegrate in life. So she is pleased to have that one introduced. She's also introduced AB 877, working very closely with Lori Durand and advocates for responsible treatment, so thank you for that. And that one is really focusing on the insurance issue. The Assembly member does believe, and I know has had some very good conversations with some of her council members in Newport Beach on this issue too, that unfortunately there is probably a lack of awareness, and there is quite clearly fraud that goes on with some of the bad operators in the industry space. And so this legislation would require that insurance providers are notified at these DHCS licensed homes that there is no medical treatment being done in these homes. And if there's no medical treatment, in a lot of cases, there probably shouldn't be insurance coverage of that. So we are looking forward to that moving forward. And then there's a third bill that's being introduced today. I don't even yet have the number, so I apologize for that. But as soon as I do, we'll certainly give an update to everybody. And similar to what the league was, I think, sharing with Senator Blakespear, and the result of that audit on the timeline issue, we also believe that there is a question here that deaths sadly have happened in some of these locations, and specifically, as we know, in a neighborhood in Newport Beach, and so it's something that she's really focused on. And so she has legislation that when there's death in one of these facilities, that there must be a report of that, certainly from a timeline standpoint, but beyond that, what led to it, what steps were taken, and then what steps will be taken to prevent that in the future. So it's specifically a report and timeline relating to the very unfortunate, terrible situation of when there's a death in one of these facilities. And then finally, as I think that she also alluded to last week, she is still looking at the possibility of introducing another audit request, but specifically to homes that are licensed and regulated by DSS, which is the social rehab homes, and sort of that next category. As I know this group is probably aware, there's sort of this whole industry now that's been created where really it's the patients who are the victims. They're brought in often out of state. They're put in these detox facilities licensed by DHCS. Often some of those same operators then go pull another license in the DSS space, and then they're passed off onto there. And so she'd really like to make sure that we can get our arms around that too, on what steps are being taken to regulate and ensure that there's responsible treatment and care being done there. That's our update.
Thank you so much. Okay, who else do we have online?
I have a quick question for Kristen.
Hi.
Okay, hang on. Go ahead. I don't know.
Sorry, I can go ahead. My name is Katie Guthrie. I'm with Assemblymember
Thank you,
Valencia's
Katie.
office.
Yes.
Yeah, hi. Thank you for letting me join you guys this afternoon. I don't want to be too repetitive from Caroline and Connor's presentation on AB 492, but from our viewpoint, it makes sense to provide this notification to cities. Currently, cities and local governments already receive other types of notices for types of licensings in the state, such as approval for syringe exchange programs, liquor licenses, and dispensaries, as well as this notification will just allow for better tracking and allow local governments to identify trends of clusters of treatment facilities. So we're really happy to partner with Cal Cities on another piece of legislation related to this topic of substance use disorder treatment facilities. I will also drop my email address in the chat. That way you guys can reach out with any questions or follow up for a fact sheet on this bill.
Perfect, thank you so much. Do we have anybody from?
We have
Daniel from Lori Davies, Assemblywoman Lori Davies. Daniel?
Hey, yeah, sorry, I'm here. I'm actually out sick today, so I look kind of rough, so my
Sorry, Daniel.
But yeah, nice to meet everybody, and thank you so much for inviting me here to speak today. My name is Daniel Foxello. I'm a legislative assistant for Assemblywoman Davies. So this year, we originally only had 3 bills in our package regarding this topic. The Assemblywoman wants to do a 4th now. I don't have the details on it yet fully fleshed out, but the general idea is to use Proposition 1 money to allow the counties to have their own inspectors. And so really the problem is DHCS only has about 12 inspectors for the whole state. And so this would be a good way to provide more localized control and to ensure that these facilities are being held accountable when things are going wrong, and it'll help really get down that response time. The other bills in our package, we have AB 423, 424, which you heard about from my colleague Caroline, and AB 425. 423 has to do with the act of curbing, and so you kind of heard about that earlier too. After the initial 30 days where their insurance runs out, a lot of these places will just kick people onto the curbs.
Yeah.
And so what we're trying to do is to require them as a condition of licensing to have plans of travel or continuing care plans for the patients so that they're just not left up in the dark, you know. 425 has to deal with creating evidence-based standards for certified places in like retail areas, right? And so this is basically, I mean, it's simple. We just want American Society of Addiction Medicine standards in these places. We know they work. We know that they're science-backed, so we think, why not, right? So yeah, and I can totally put my email in the chat too if anybody has any questions. I'm always open to suggestions too, so thank you so much, everyone.
Thank you so much, appreciate that. Who else do we have? Do we have Senator Blake Spear available? Excellent.
Yes.
Paige.
Hi, my name is Paige Apperson. I am here in Kim Carr's spot, and thank you, Connor, for explaining what SB 329 will do. It will require the Department of Healthcare Services to assign complaints about treatment facilities to staff within 10 days, and then they have to complete that investigation within 60 days. The senator, you know, she believes that good governance means intervening when, you know, the safety of our neighbors and these treatment facility residents are, you know, possibly in danger. And she thinks this is a common sense bill that is co-authored by Tom Umberg, Senator Umberg, and sponsored by the cities. So we are hopeful for this one. It was introduced on February 11th, and I will also drop my email in the chat if anyone has any additional questions.
Thank you so much, Paige, appreciate that. Anybody else online? Oh,
Hi, yes. My
yes,
name is Caleb
Caleb.
Bieber. Yes, thank you. My name is Caleb Bieber. I'm the Legislative Director for Assemblymember Darshana Patel. We have a bill, and firstly, I just want to say thank you. It's my first time being on one of these calls, and thank you to specifically Lori for all of her help with this policy. We have Assembly Bill AB 448, which would create a requirement to require short-term residential therapeutic programs, specifically ones with minors, to ensure that at least one parent or legal guardian will be residing at a single physical address within the state for a child during the duration of a child's youth treatment. This is an issue I know many people are aware of, both outside of California and in California, where parents are nowhere near their kids who are getting treatment, and this is an issue we certainly want to work on. We have quite a bit of language amendments that we want to make. We just got this kind of through. And then additionally, I wanted to invite everyone here to future hearings that we're going to have. The boss wants to do a select committee on this issue of treatment, specifically youth treatment for mental health and addiction. And really just want to extend an invitation to everyone, and I'll have more details once we get approval from the Speaker's office on our upcoming hearings. And I'll also put my email in the chat. Thanks, everyone.
Thank you very much, appreciate that. Okay, those are the updates. We're gonna get to questions, so hold them, thank you. We're gonna go back to the county and get an update from Nick, because he has some great news.
Hi everyone, yeah, Nick Yanis, Chief of Staff to Supervisor Katrina Foley. I think many of the people here will remember last year that the county sponsored legislation carried by former Senator Josh Newman to add definitions to currently unregulated group and sober living homes, which was ultimately not successful. The goal of that was to create a pathway to, frankly, get our housing element approved. So that was not successful. However, moving forward in November, when we were working with the state on our 6th cycle of our housing element, the state came to us and said, you need to remove your sober living home ordinance for us to approve your housing element, which the board strongly disagreed with. We were kind of mulling around what our strategy was going to be on that, and then in December, the 9th Circuit ruled, federal court ruled that Costa Mesa's sober living home ordinance was not discriminatory. So we thanks to Assemblywoman Connie Petrie Norris, she was able to get the county and our legal counsel a meeting with HCD and the Attorney General's office, and it was a very spirited meeting where we went back and forth and talked about the merits of the case. And we were able to come up with compromise language in our housing element that the board voted on last week. And the good news is yesterday we received our substantial compliance letter. And so I'm just going to read the first part and we'll send it out to the group because I know many jurisdictions are struggling on what they're going to do with their sober living home ordinance. And hopefully we have some precedent here.
Yes.
But in essence, what will be added to our housing element was that the county will review and revise its group home and zoning ordinances as needed to ensure ongoing compliance with state and federal fair housing laws. So in essence is, we're just gonna make sure we keep complying and we were certified. And so we haven't had a housing element in a couple of years at the county.
Yeah.
And I know many cities were struggling, so we take that as a very good sign. We're thrilled and we'll be sure to send that around to the group also.
Thank you. This is great because a lot of us didn't put any language on sober living in any of our, we didn't do it because we were having this pushback from HCD. So this is huge for all of us moving forward and feeling confident in coming up with an ordinance which we together here will come up with a ordinance that hopefully we all can utilize so that we can be consistent. And I think that protects all of us as cities individually. And we know some of our cities have stepped out and done it, and we're thankful for that, especially Newport Beach, Costa Mesa, and those that have dealt with the lawsuits, shall we say.
And I think the good news is that the County of Orange's particular ordinance was actually even stronger than Costa Mesa's. It's considered a strong ordinance. So I think we're hopeful that folks that have current ordinances will be covered in that sense. Should be good, so we're excited for that.
That's great. Okay, well, thank you very much. Anything else?
Nope, that's it.
Okay, terrific. Okay, next up, we're gonna hold off on a legal update for now. And then we'll have a law enforcement update from Captain Jason Ivins, and you're gonna talk about Prop 36 briefly.
Correct. So Captain Jason Ivins from the City of Mission Viejo. So back in November, voters overwhelmingly voted in Prop 36. And what Prop 36 did, as you know, it rolled back some of the stipulations on Prop 47, which took place back in 2015. And it gave us some enforcement teeth back for law enforcement to take into custody people for drug offenses and theft offenses. So while it didn't entirely do away with some of the things in Prop 47, what it allows us to do with some new penal codes and H&S codes is allows us to custodially arrest people with prior convictions for drug and theft offenses. So those, you saw those people on the news, $950, right? I can steal $950 and they're just gonna give me a ticket. Well, it's not gonna happen anymore. We're actually be able to take the people into custody. And while it's not, directly related to sober living issues, it is because it's drug and theft, and they're gonna end up getting some kind of treatment program down the road anyways. So it also, we got some new, with the help of Sheriff Barnes, some new laws related to fentanyl, which allows prosecution for people with fentanyl if they have a loaded weapon, if someone dies after a dealer gives them fentanyl. It just adds more teeth to those fentanyl-related crimes because it's such a scourge right now in our society. So other than that, that's all I got.
Thank you, appreciate that. We're gonna do a legislative update, Lauren?
Well, I think we got the important update.
We did,
I'll just report
but
on the
you have an
activity.
ad hoc committee.
Yes. The ad hoc committee met several times since we last came together as a whole task force. We submitted letters to ask for support on this issue with an emphasis on the need to protect individuals seeking care, increase standards for safety and fraud, and prioritize treatment beds for California residents, which of course would in turn benefit our communities. And with the help of Assemblymember Dixon's audit and Venture Strategic, we reached a number of legislators outside Orange County who are new to the issue, which is fantastic. And we were heard. We are so pleased, I will emphasize, so pleased at the traction that we're seeing this legislative session, and also extremely grateful for the engagement of all of our regional representatives who really have demonstrated such steadfast commitment to this cause. So I think now the onus is on us as a task force, right? We have a tremendous opportunity to affect change, and we need to rally and double down on our efforts to get our message out so that these bills will hopefully be successful this go around.
Yes, thank you, appreciate that. And to this point of these proposals that have come up, both those that are out there in Zoom as well as here, and these proposals that are coming before the legislature. You heard the big ask, and that is show up and testify. So we have been doing quite a bit of videography and testimonies that we hope will be helpful, but we are prepared also to find a way to get people up to testify, and specifically people that have been impacted, not just the electeds, but the actual residents who are impacted, which I think is meaningful when you're testifying in Sacramento. So I want to encourage folks to be thinking about that in your own cities. And then we're a voluntary group, as you know, and one of the things that I asked at the last meeting, I'm going to say it again to everybody that's here. These meetings are growing. We have the opportunity on our web to do the Zoom so that more people can join, but bring along a council member that's in another city to let them know about this, because we're getting traction, the years of work that we've put into this, that I know many around the table have been working in their own ways, in their own cities, and residents and electeds, and those that came before us have laid the groundwork, but I think we're on the precipice of something really great here. And with that, I'd like to have some time for some questions. Are we good?
We do have some online questions.
Can I add one point to
Yes.
your point? Yeah, and I think it's really important to recruit folks outside of Orange County, because
absolutely
some of the feedback we received last year, our legislative efforts, is they're not here, like members of the legislature aren't hearing from like their local council members or elected officials. So building that is important. That directly connects to the advocacy of Sacramento.
And by the way, we met with the city of Sacramento. We did. Yes. Anyway, so that was exciting. And there are other cities that are very interested in what we're doing, other counties, et cetera, and that's exactly what I'm talking about. So I even brought this up at the Conference of Mayors when I was in Washington, D.C. I brought it up at any of the statewide events that we have, because I want to let people know what we're doing. So I know people have questions.
And just a couple of updates for you on that.
Okay.
Outside of the city of Sacramento, we've had some initial discussions with some Bay Area cities, some Riverside County cities, the county of Riverside. We're talking with folks there. Also had a discussion today, interest with Supervisor Jeff Burrell and his staff has asked for a briefing in Ventura County. So we're providing all of the information to their office as well. And to that end, if you're in this room, if not, it's posted online. We have provided exhibits from the state audit that Assemblymember Dixon called for. That includes the heat and plot maps that shows the concentration of these homes all over the state, and then there are examples in there in Orange County and Ventura County, which are just two samples. And of course, those are conservative estimates, as Lori Duran will point out. That even the state's data may not be picking up on all of the homes that are probably in those areas, and that it's probably even more heavily concentrated. But those are available, and they're great visuals as you're having discussions and advocating for these rulings. And then lastly, just to the chair's point, we do have all of the testimonials that we have captured thus far and the stories that are being told. And those heartfelt stories are posted on SoberLivingTaskForce.com, SoberLivingTaskForce.com. If you have a story that needs to be told, if someone in your community is willing to tell a story, no matter where they are in the state, we will get a camera in front of them, and we want to document their story so that we can continue to share that. Those will be important testimonials to provide to committees during hearings on all of the legislation that's been introduced. So please reach out to us by email, through the website, or by phone, and we'll get our cameras in front of those people.
Thank you. So I know we have got some questions in the room, then we'll go online as well. Go ahead, Robin, I saw you earlier, and I apologize.
That's
for cutting
okay.
you off.
I just, it's kind of rolling back a little bit here, but, Kristen, when you were talking about the third bill by Assemblymember Dixon.
It's just being introduced today, so I'm sorry I'm a little late on details.
It's okay, you may not even know, but I'm curious, the report that's gonna be given for a death that occurs in one of these facilities, the report's made to who? You mentioned that if there is a death in a facility, that
Let
there would.
me, and again, I apologize, because
We can
literally my
do this
budget
offline.
director sent it to me right, I can give you a copy of it too, but let me pull it up here. And give you any information that's in here.
I'm just wondering if the cities would also receive, like, if part of the bill is that the local, entities would also receive notice of these, or if it's
Yeah,
just.
it's not really specified yet, in the bill, but again, it may be, it's just I might not have the latest copy, so I might, let
That's
me
fine.
back you.
It's just something to
Yeah,
mention too.
It's likely gonna be law enforcement, and they usually report things to us,
But I'll
as council members. Yeah.
Well, the fact of the death would be reported to law enforcement, but the intricacies
Oh,
of how it
the
relates to the sober
I got
living,
you.
what, that's sort of another
critically
level
important.
of.
Agreed.
Yeah, that's a good point. Yeah. Okay, any other questions around the table here, because I'm gonna go online.
Can I just piggyback really quick?
Yes, please.
So great question, and thank you for asking that. In
Yeah.
the city of Santa Ana, we have 89 sober living that we can identify. Several of them are not licensed, and so that is great information to have, because then law enforcement can look into it, but also as a city council, we can address it. We're actually bringing an ordinance similar to Coastal Basis, so thank you, Nick, for sharing it. We'll get a copy. We're bringing it early summer for the city of Santa Ana. And I really encourage everybody to, as it's being recommended, to take that position, because the needle exchange was coming to Santa Ana.
Yes.
And I reached out as the mayor to all the mayors and all the cities and, electeds, board of supervisors for letters of support. And they were fighting hard to come to Santa Ana. It was a fight. And Sheriff Barnes, Assemblyman Valencia, board of supervisors, mayors, electeds sent us letters. And we won, and they're not coming. And so, and it's not because we don't believe in that, it's just that, they were gonna give out 300,000 needles and only collect 120 of them and leave the rest on the street. And so, we have to really take a strong position on this. And so, thank you for all of this. If we have not given you a letter of support, I'll make sure you get it early next week. So whatever we can do, as you know, we're at the table with all of you.
Yes, and we appreciate it, and I think you have done that, so
So,
we thank you. And we're gonna be doing a model ordinance, I thought, our task force, to try to help all the cities, so we're working and going down we're all rowing the same way.
Perfect.
And as a result of the Ohio House case,
Right.
And the Ninth Circuit decision, and some of the preliminary work that Bill Curley had done on putting some of the aspects of the draft ordinance together, that now informs the language that would be acceptable and a common draft that could be circulated. So I know that he is moving that forward and probably would like to.
We are working on that. We were kind of waiting for our housing ordinance to be final too, just to be clear on that. And so, I'll work with Jeff
Let's do that.
on that too, because we were already.
So that we can keep it moving,
We
and
just
that
want to
way.
make sure it's ironclad and it's got this yesterday, so.
Once you get it, you'll send it out to all of us so we can use the center. Perfect.
Perfect.
And now the task force is officially its own nonprofit entity under the supervision of ACCOC.
Right.
We'll be working with Chris Murray, and that may be something that goes through the ACCOC committee process for some additional input from.
Right, because
all
ACC is
officers.
very good, ACCOC has been very good at model legislation, model ordinance, city ordinances on other topics, so it makes a lot of sense.
And we can make sure it's distributed widely and partner with Cal Cities to get it out all over the place.
Perfect. Okay.
Question,
Oh,
please?
yes.
Yeah, I was wondering, Jeff, you made earlier mention to the heat maps and the representations from the state auditor's report. The mayor just mentioned that there's 89 facilities in Santa Ana. I'm looking at the map and not even close. There might be, it might represent perhaps as little as 20, maybe even 15. So what can we as a group, how do we as a group affect the accuracy of maps like this? Because when we go back to our constituents, or I go back to my council, and I want to fight and say, hey, we need your support for this. Look at them all. I look at this and it's like, it's not that bad. And it's obviously a big miscalculation. So what can we do to try to become more accurate on these maps?
Well, I would just, my comment, and certainly any others in the room that have comments, but just to answer your question initially, I would suggest that that's a great follow-up question that Assemblymember Dixon may want to ask in a follow-up audit request to dig further into how the state is tracking this data, to bring some more transparency to that and where those, what appear to be conservative estimates, to say the least, are coming from. I would also say that you have 2 exhibits in there. The heat map is probably a better map to show the concentration, which is really to the larger point. The plot maps probably are where you've seen the individual dots on the map that may represent a different type of home. Maybe very conservative and probably missing a lot, and it doesn't account for those that are operating that aren't licensed, right? So
right, these are all licensed.
So we can provide some supporting talking points from the task force that speak to that, that help councils and participants as you're communicating this to your constituents and the public. And I know Lori and the mayor and others may have suggestions or comments on that, but those would be my initial suggestions.
We had a proposed bill that has not yet been picked up, but it would make a very big difference on exactly this point. The critical thing being that we have to define businesses operating in houses, providing care services that don't fall into all the other social services definitions. Without that definition, we can't get to accounting. But we could, if we defined them, just simply ask for a census of those, require that those report themselves to DHCS, and then have an accounting of all the businesses operating in the state of California, or all the houses operating in the state of California. But we don't have that bill, or it's not been adopted yet.
All right, thank you, Lauren. Okay, let's go online.
So we have, Susan is a resident, and she's on. Susan, are you there? She's chatting.
Oh, she is, okay.
I don't know if she's.
Susan, can you unmute and
Susan,
ask your question?
Susan, are you there? Okay, well, I believe she also commented that she is willing to tell a story, so we'll definitely follow up with her.
Can you hear me?
Oh, here we go. Susan?
Hi, I'm not in the best mind frame, as you could imagine. My son died 3 years ago. I've had him in multiple facilities paid for by private insurance. Most of the time he was local. When I sent him a little bit further away, he died in what I didn't know was a sober living. I live on a street here in San Juan where a woman owns 2 homes that didn't want a sober living on our street, even though she made millions off of these people. And I see both sides of it, you know, I see the suffering of the people who have the addiction and the mental health issues. And I also see the other side where we don't want this on our street. Yet, my son drove a vehicle through somebody's garage door higher than a kite. Definitely somebody I admonished. I did not tell him, hey, that's okay, honey, you know, you're gonna be fine. I told him, you could have killed somebody, including yourself. What about children? And yet these neighbors are like, well, we like them, but they don't like these sober living people that were coming next door. And this woman who made millions off of them was screaming at one of them in their private yard, thinking she owned the place because they were addicts. We need to figure out how we're going to treat these people from a mental health standpoint as well as the addiction. We need to come to a point where Orange County Police Department, when we call them, they don't look at you like a mom and say, what are you doing here? Like they told me when my son was claiming that he was dying in the Mission Viejo Mall parking structure at 3 in the morning after some kind of attestation in another place. And all I was doing as a parent was showing up for him, and he was an adult, and they didn't want to take him to jail. There's got to be some kind of accountability. And I'm going to say this publicly right now. I sued this facility out in Riverside County for my son's negligent death. And it was Ken Seeley, who's on this A&E channel as an interventionist. And you know what? He didn't want this lawsuit to interrupt his vacation with his husband. You know, this is the kind of field, it is not a medical industry, okay? They know that there's 12 people up there in Sacramento and none of them are going to be able to handle this. This is about our kids. This is about our community. And this is about making a difference. Read Terry's story. She was very helpful in at least getting it out there, but I will tell the world, none of this should be happening. And I was a good mom to him. That's all I have to say. And I miss it to death, but he should not have died. And Peter has a picture of him, laying there in a bed where he was supposed to be getting help.
Well, thank you for sharing, and I know how hard it is. Please stay with us because and stay engaged with us. We're going to make a difference. That's our goal. This is our passion, and you have people that are sitting in the room that have stories that they likely can share with kids as well as in their neighborhoods, etc. We feel that if we can help the patients be cared for properly, that the neighborhoods then will also benefit from the same.
But sadly, I'm going to say this, and let me correct you. They're not even patients. They're called clients because there's nothing medical about their treatment.
Thank you for, okay.
This has got to stop. I've got a neighbor who owns 2 houses. She has absolutely zero medical background. All she has is a KDAC, and she's made millions off these people, and she doesn't want them in the neighborhood. It's a not in my backyard kind of thing. And she sued United Healthcare for all this out-of-network stuff. It is a money grab, and we need to stop it. It's a mental health situation. We need to help these people. I did not raise a mentally ill child. I tried to help him. I have 2 other kids that were raised the same way that are perfectly fine, even though they've gone through far more than what he has. We need to make a difference, guys, and I'm so grateful for you being here and being willing to listen to me.
Thank you.
But I will share my photo, and Peter's welcome too. That is my son laying in a bed, and an interventionist who's on TV convincing people to spend money to absolutely do zero. And they know that the Department of Healthcare Services, who I've spoken to multiple times, we're not over sober livings. Well, you know what? They were acting like a non-sober living. They were supposed to be licensed based upon their actions, so stop them. And you know what? Right now, you know who's managing them? People on Calle Cerveza here in San Juan Capistrano. They continue under a different corporate name, killing people. And I have nothing more to say, and thank you for listening.
Thank you for sharing, and and you heard some of the legislation that's being introduced that we're hopeful to be impacting this and making a difference for that very thing. So we appreciate you sharing. Do we have anybody else that has comments?
I just wanted to mention that Steve McNally, who is on one of the county behavioral health commissions, who is not here in person, is online, but did ask if these bills are included in the county's legislative grid, and I believe the answer is you're probably looking at all of these.
Yeah, we're meeting with Assemblywoman Davis next week, and it's going through our process at the county legislature. But feel free to, pass them either along to Peter DeMarco and our county staff, or to Amy Jenkins, who's our state lobbyist, but they should all be on their radar.
And we'll be providing the summary of everything reported out of this meeting through the task force and CCSD.
Okay. thank you.
Cal Cities will work
Cal
together.
Cities.
Yes. And anything else online?
No,
From-
that's it.
That's it? Okay. All right, well, thank you, and I think,
Sure.
yes,
I just wanted to add, we're also gonna provide letter templates, right? For cities
Thank
to
you.
get out to.
Yeah, I think one of the things that might be helpful is to, let the legislative offices know that we're willing to help, whatever we can do to support.
Right.
We're here to do it.
so are we developing some letter
We
templates?
do. We have.
They're already out there.
We're on draft 2.
Okay.
Yeah.
Connor, you guys are also, right, have you just drafting letters?
We do draft letters, yes, we're still in the process of drafting them, so they'll be coming in the very near future. They're not out yet, I did see that, there's other draft letters from Venture that they have drafted that,
So what we'll
we can
do
look
is
at in the
they'll-
meantime, but we will have ones for cities
Okay.
officials specifically in the near future.
And so the cities, a lot of times plug into those. The residents that we are hearing from can go to our website and look at the letters that are there. And you, and it's ones, I mean, it's there for you, for everybody. So for cities, residents, et cetera. Because we want you to have the resources and empower you as residents as well. That's the unique thing about this task force is that we have residents at the table with us.
And Madam Chair, I would say that the strategy around that legislative advocacy has phases to it, as all the legislative offices talk about their legislation. There's phases. There's the bills having been introduced, and legislative offices, members who would like to collect support letters at this time to include with their testimony. Then as they get assigned to committees, there may be a request from legislators that we direct letters and communications from the public to those committee members, and so we'll adjust and we'll tack at each stage to support the legislators as they request us to direct those communications to different, audiences, and then last would include a portal on the website that people can access, so they can easily send a letter electronically off from the Sober Living Task Force website, so that it's really easy, and we can certainly increase the volume from around the state that shows the broad spectrum of support for these reforms.
And the testimony that we're going to need, so I just heard compelling testimony, I think we all just heard that. There's a testimony there, and those are the type of things we want to hear.
For this first phase, what's the most important?
We're waiting now to determine what committees that they'll be referred to, and then that will be it. It will be to get witnesses for those committee hearings and to target those members on this.
So are they equally weighed, the support letters from electeds and from impacted individuals?
They're
or
certainly
should
all
we-
considered, absolutely, all considered. Equally weighed depends on the legislator who's reading it.
Fair enough.
Many, a set of bills will come to committee probably the third week of March to get the staff, the council, the committee, staff, counselor, whatever they're called, to write something about what those people have said. It has to be in at least a week in advance. We're looking at deadlines of like March 10th for initial letters. We won't know, there will be some that aren't actually heard until April, but the ones that are heard the third week of March, we need those letters now.
So we will post information on the website to facilitate those that are gonna be heard the third week of March. That's our plan.
That's correct, and if there's an early opportunity for our legislators for us to send letters to them ahead of committee assignments, and they can collect volume. But we certainly, I think we want to work with each legislator to ask what their preference is.
And is there a way for folks to sign up on our website to get email alerts?
There it is.
Okay, so go to the Haslar soberlivingtaskforce.com, and you will find it's a one-stop shop, and you will find links, et cetera, of anything that you need. So let's go ahead and wrap this so that we can.
Madam Chair, I just have one question.
Oh, sure, go ahead.
Just one question. So your point about the letters should be going out sooner rather than later, right? You say the second week of March, by the second week?
March 10th,
So,
yeah.
Is there, I just want to be clear that there's a letter that I can share. So I meet with the neighborhood association, 63 of them monthly, and I'm meeting with them on Tuesday. I would love to give them a copy of the letter so they can send them in, all 62 neighborhood associations, and so, in support of. so.
Well, I know the guy who writes the letters. So
Very
we
good.
can add him in, so
All right, we
I'll
get
make
one.
sure you
Please.
have it.
Terrific, thank you.
Yeah.
Terrific.
Thank you very much. We want to get them in before March
Right.
10th, right? So, okay.
Okay, for those that are being heard at that
Correct,
point,
yes.
absolutely.
We have, Carolyn Grinder has a comment.
Yes.
Carolyn, are you on?
Yeah, I think my comment was covered. I just, I really appreciate this conversation about getting letters in and supporting all the bills this year. I think we have a real chance at making a change. I can't underscore the importance of getting those letters in and coming to Sacramento and making your voices heard. It's the most impactful way for us to move the bills forward. So I really appreciate this conversation. Thanks for focusing on our bills.
Thank you so much, appreciate that. So again, expanding the coalition beyond Orange County, important, think about that as we're out and about, because we all serve on regional boards. That's gonna be part of our success and advocating for this. And then I just wanna thank everybody for the great conversation today. This was a really great, robust meeting with lots of input and lots to report. So I'd like to go ahead and conclude the meeting, and please feel free to stick around and chat, etc. Any comments, questions, follow-up questions you have online, please pop them in the chat. And we thank everybody for coming, and drive safely home or back to wherever you're gonna keep working. Thanks, everybody. Thank you. Great. Oh.
Hopefully you can join
Middle. This is
Yeah, so I have the map also.
Absolutely.